me see. All right.
Hello, I'm Savannah. I'm going to be your student nurse today. How are you?
Good, how are you?
Good. Can you tell me your name and date of birth?
Olivia Sebastian, 7204.
All right. Do you know where you are?
And your room, and Vera,
Okay. And do you know why you're here today?
to do a head-to-toe assessment.
All right. So she is alert and oriented off the bat ×4 to both time, place, manner, and person. Off the bat. So after I introduce myself, I would tell her all that she already knows. I'm going to be doing a head-to-toe assessment today. Is there any reason why I cannot do that today?
No.
Oh, okay. That's good. That's implied consent. So off the bat, I would be assessing my patient as I walk through the room. I would notice that she's sitting up straight. She's talking to me. She doesn't look to be in any kind of distress off the bat. Are you experiencing any pain today by any chance?
No.
Any problems as a note?
Nope.
No? Alright. That's my assessment. She doesn't seem to be like flushed or anything that I would notice. And she seems to be ready for the day. She doesn't seem to be aggressive. She seems to be compliant and all of that stuff. Right. So right when I walk in the room, I would be telling her I would usually wash my hands. And then I would take her vitals, which would be her respiratory rate, her blood pressure, her temperature, do her pain scale, which I already have asked her. Can you rate your pain on a scale of 0 to 10 if you have any?
No, I would rate it a 0.
Alright, that's good. She doesn't have any pain. And I would also check her pulses, but we'll be doing that later. To start off the head to toe, I'm going to be inspecting your face. Is that alright?
Yes.
Alright. So first I would assess her face. She seems to be having normal color. Her face seems to be very symmetrical. There doesn't seem to be any deviation to one side or the other. Can you smile for me real quick? Alright. There's no lag between her facial movements that I can notice. Her ears seem to be very symmetrical on both sides. She doesn't seem to be having any like redness or edema or swelling. Then I would palpate her face. I'm just gonna touch you real quick. I did hand sanitize my hands before this with my hand washers. I'm just gonna touch you real quick. Feel any tenderness or anything?
Nope.
Alright. So from that, I don't notice any swelling of the face. I also can feel that her skin is dry and warm, normal to the touch. Have you been experiencing any trauma to the face recently? Like no cuts, I don't see any.
Nope.
But any trauma? Nothing. Okay, that's wonderful. Great. Then I would, while I'm here, I'm going to go ahead and inspect her eyes, her nose, and her mouth. So I'm going to take my pen light and I'm going to assess your eyes. So off the bat, I can see that her sclera and conjunctiva are pearly and white. There doesn't seem to be any mucus or anything leaking from the eyes. They both seem to be watching me as I'm talking and seem to be reactive. There's no redness or any veins that might be popped or anything like that. Have you been experiencing any problems with your eyes? Any blurriness?
Nope.
Excessive wateriness in the eyes? Nothing. Okay. We would also test her vision with a Snellen chart, but I don't have that today. But I just wanted to make that note. So I'm gonna check her pupil reactivity. So I want you to just look at my nose real quick. All right. I'll give you a second. I'm gonna do it together. Watch my nose. Both pupils constricted with the light, about 2 millimeters, both sides, both equal, perfectly reactive. Her irises seem to be normal. They're both circle shaped. They're not oval or anything like that. All right. Then I'm going to test her fields of gaze. So what I want you to do is I want you to look at my pen light, and I want you to follow it, but do not move your head. Okay? She followed that perfectly. She didn't move her head, and I could see your eyes were watching it the whole time. Was there any pain or tenderness while we were doing that?
No.
All right. Now I just want you to look at my pen light again, and just keep focusing on it. Don't move your head. Don't move your eyes. Keep looking at that pen light. Okay. So her eyes crossed while looking at the pen light, which is normal. There's no lag between the eyes, which is really good. Sometimes if, like, say one eye did not follow, they could have either a neurological disorder or an eye problem. I know that some people with amblyopia, sometimes that eye will not move, but you do not seem to have that today. Do you wear any prescription glasses or contacts or any assistive care with your eyes by any chance?
Nope.
All right. And do you happen to know what your vision is? When the last time you went to the doctor for your eyesight was?
Perfect. 2020.
All right, that's really good. Okay. So next, I'm going to be checking her peripheral vision. So what I want you to do is I'm going to move my hands, my fingers, and I want you to tell me when you can see them.
Okay, I can see it.
All right. And then I'm going to have a number on my hand, and I want you to tell me when you can see it, but I want you to look straight at my nose. Okay.
Okay,
All right.
I can see it.
What's the number?
4.
Alright.
I can see it.
Okay, we're gonna try that again. You moved your eyes.
Oh.
Just keep looking at me.
Sorry. 3.
Okay.
2. 1.
Good. So her peripheral vision seems to be perfectly intact. You can see her eyes at the normal range. You could also see on all of the fields from top, bottom, left, and right, which is wonderful. Next, I'm probably going to move on to her nose. So if you could actually tilt your head back for me. Right, I'm going to inspect. Off the bat, her nose doesn't seem to be flaring or anything, which could indicate pain. I don't see any drainage happening from her nose, either purulent or anything. I'm going to flash my light up your nose, and I'm just going to inspect it, okay?
Okay.
All right. All right. I don't notice any polyps or any impacted drainage in her nose, which is all good. There does seem to be a little bit of redness from maybe wiping your nose recently. Yeah, from the allergies. That happens. But nothing else that I would notice. There's no swelling or anything like that. And her nose is perfectly midline. And the ridge of her nose seems to be perfectly fine. Is there any tenderness when I touch your nose?
No.
Great. Next, I'm going to move on to inspecting her mouth. I do have a tongue depressor that I'm going to use. There's no markings on it. Great. So, if I can have you open your mouth for me real quick. I'm just going to inspect it. Can you smile? And can you do big so I can see your gums? Perfect. Now I'm just going to take this tongue depressor, and I would usually have gloves on when I'm doing this. It is sterile though. And I'm going to put it on your tongue, and I want you to stick out your tongue, and I'm going to put it on, and I want you to say ah, okay?
Okay.
Go as big as you can. Alright, perfect. I'll put that away later. So upon assessment, her gums seem to be pink. There doesn't seem to be any inflammation, no ulcers, or any signs of infection such as thrush that can sometimes happen. Her tongue is also that perfect color. It's not deviated to one side or the other. I did notice any dental caries in her teeth, and her uvula did move whenever she said ah, which is good. All right. I also would inspect the lips. They don't seem to have any dryness or anything. They seem to be perfectly pink. No excessive swelling or deviation from one side to the other. Have you had any problems with your mouth, either with your lips or anything sore in your mouth by any chance? Nothing recently?
Nope.
All right, that's really good. There's also no cyanosis anywhere on her face that I would like to note from both the eyes, nose, or around the mouth, which is good. So that can indicate some good oxygen perfusion, so we don't have any lack of that, at least in the facial area that we can know. Next, I'm going to inspect your ears. So on the adult, when we're inspecting the ears, we're going to pull up and back, but on the children, we would do down and back because of the different anatomy structure. But first off, I'm going to inspect the auricle of her ear, which is the outside of her ear. It seems to be the same color as the rest of her skin, no redness. She does have 2 piercings on both sides, but they seem to be perfectly healed. Have you had any problems with those piercings?
No.
Alright. Then I'm going to pull her ear up and back. I usually have an otoscope that I would use, and I would inspect it. We're going to use our pen light today as best we can. I didn't see any impacted cerumen. You seem to have very good clear ears. There was a little bit of hair, but that is normal, as that helps people to hear in the ears and should not have any problems. I'm just going to check the other side real quick. Alright. There's no tenderness when I move your ear, is there?
No.
Okay. So again, her ears can be fine. There's a little bit of cerumen in the other ear, but that's obviously normal. It doesn't seem to have any impaction. Have you had any problems hearing recently?
No.
No? Okay. I do want to do a whisper test. So what I want you to do is I want you to take your left hand, and I want you to close your ear, and I'm going to whisper something in this ear, and I want you to just tell me back what I said, all right?
Okay.
You ready?
Mhm. 82. 37. 19.
I want you to do the same to the other side.
12. 54. 22.
Perfect. All right. Ooh, I'm so sorry.
You're
I
good.
stepped on your toe. So she passed the whisper test, which is wonderful. We would also do a test with a tuning fork, and we would place it on either the center midline of her head or in the middle of her forehead in order to test to make sure that she can hear the vibrations equally on both sides. I do not have a tuning fork today, but that is what we would normally do. We would also take that same tuning fork and we would put it on the bone of her ear right here to test her hearing as well. But I do not have it today, but we're going to improvise by saying that we did it. All right. Are you doing okay right now?
Yes.
All right. Please tell me at any time if anything is hurting you or anything like that.
Okay.
All right. While I'm here, and since I'm kind of already assessing some of the nerves, I'm just going to go ahead and continue. So I am going to palpate your lymph nodes real quick. Is that all right?
Yes.
All right. Please tell me if there's any tenderness at any time.
Okay.
All right. You all right?
Mhm.
A little ticklish?
Mhm.
But no tenderness, right?
No.
Okay. I'm also going to check your temporal pulse real quick. Seems to be strong, 2+ on both sides. Perfect. All right. Any tenderness at all?
No.
Any, did anything hurt? Have you had any problems in the past?
Nope.
All right. While I'm here, I'm going to go ahead and auscultate her thyroid real quick. So if I can get you to tilt your chin back. Alright, there were no breweries, so there were no abnormalities of breweries in the thyroid gland, so I would not suspect anything of that, although we wouldn't completely rule it out. Next, I'm just going to move this. If I can check your carotid and for JVD real quick, so if I could actually have you lay down. Let me get these pillows, hold on. It's just for 2 seconds, I promise. Alright. So what I'm going to do is I'm going to, can't see. I'm just going to inspect her carotid artery for any JVD. So if what I could do is if you could turn away real quick.
Did you want me on the side? or
No,
want
just turn your head. I
Okay.
apologize. Alright. So I'm going to inspect. She doesn't seem to have any JVD, and I'm going to auscultate it first for palpation. If you could just hold your breath real quick. Alright, you're good. And then I will pop. Alright. You can go ahead and sit up now. I usually do this on both sides, but for the sake of time, I only did it on one. I'm gonna turn this back towards here. Alright. There were no bruises or thrills that I could hear or feel in the carotid artery. There was no JVD or jugular vein distension that I could see. If you could turn that way real quick. Yes. Again, no JVD. We also tape before we palpate just in case of a clot, so we don't want to set that free. Alright. Next, I'm just going to kind of inspect the rest of your throat, so if you could just look straight and sit up straight for me. Alright. Trachea seems to be midline. Inflow Your sternal notch is also midline, which is great. Have you had any problems swallowing by any chance, or any soreness in your neck area or
No.
anything? No? Okay. Normally would also do a swallow test, just to make sure they can swallow, especially in the hospital, to make sure they don't have any dysphagia or risk of aspiration, but I don't have a cup of water today. Alright. Next, I'm going to, if you could remove your jacket real quick. I'm sorry if it's a little cold.
There you go.
Alright. Next, I'm just going to kind of inspect her skin. So, I'm just going to touch you real quick. Any soreness?
No.
Alright. Her skin is dry and warm. If you can just kind of hold your arms out. There's no lacerations that I can see. Doesn't seem to be any edema or swelling on both arms. I'm just going to see your hands real quick. Turn them over.
No, sorry.
You're good. There doesn't seem to be any cyanosis or tar stains on the nails. Capillary refill is within 2 seconds. Both sides. That's good. While I'm here, I'm going to go ahead and assess your pulse sides in this area. So I'm going to assess your carotid pulse side real quick. Alright. Do the other side. Alright, then if I could have you kind of hold your arm out a little bit, I'm going to check your brachial pulse. You don't have to do them both at the same time. Move over this side. Then if I could have both your arms, I'm going to come over here, I'm sorry. Put them together, I'm going to check what your radial pulse is. Alright. So far you can put them down now. All of her pulse sides were equal on both sides, 2+, very strong pulse. Does any of that have any pain?
No.
Alright. And we never do the carotids on both sides, the only one, because we can cut off your circulation. Alright. Next, I will actually get you to lay down real quick again. I do apologize. And get you these pillows though. And I'm going to inspect your abdomen. Let me turn this back over here. Okay. So if I could have you just lift up your shirt real quick. Alright. You're good. So upon inspection, I don't see any lesions. There's no extreme redness. Her skin is nice and pale. It is warm to the touch and dry. Have you been experiencing any GI issues or stomach problems
No.
recently? Alright. Can I ask you when your last bowel movement was?
This morning.
And have you had any urination issues, like pain during urination, extreme frequent urination, any discoloration, such as like cola colored or orange?
No.
Any burning or anything like that?
Nope.
Alright. Do you know what color your pee has been?
Yellow. That's perfect.
Alright. So next I'm going to palpate the 4 quadrants of her abdomen. So I'm going to start at her right lower quadrant real quick. Ooh, actually I'm going to also take first. My stethoscope might be a little cold, I do apologize. Alright. There's no hypo or hyperactive bowel sounds. I did hear a little bit of growling. Are you hungry?
Yes.
Okay. So next, I'm going to palpate and percuss the different areas. So I'm going to palpate the abdomen. Tell me if you feel any pain or abdominal pressure in any of these areas. Alright.
No.
You doing okay?
Yeah.
We're not going to do deep palpation today, but I only did light palpation, but we would do deep palpation if we called for it in the clinic. Okay. Alright, next I'm going to palpate for the borders of your liver and then your spleen. Alright? Tell me if there's any pain during any of this. You might hear a dull sound. Okay?
Okay.
And I'm gonna do your spleen over here. Alright, any pain?
Nope.
Alright. You can hear the dullness from the organs below of her liver right here on her spleen. Alright. And I can actually have you sit up real quick. I think you can remain sitting for the rest of this. Alright. I did forget to do some of her sensory nerves, so I'm actually going to go back and do that. So I'm just going to wash my hands real quick. And I'm going to take these cotton swabs. I'm going to take one. Alright, so I want to test your sensation. So what I'm going to have you do is I'm going to touch you with either this soft end, this dull end of the cotton swab, or the sharp stick end.
Mm-hmm.
And I just want you to tell me if it's dull or sharp, okay?
Okay.
Alright. I'm going to get you to close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay. There were 2 times where you thought the dull was a little sharp, so I just continued to test it. But otherwise, you did seem to be able to do that. This end isn't the sharpest, so. Alright, well, thank you. I'm just gonna pop that right there. Alright, next I want you to close your eyes, and I want you to tell me where I'm touching you. So if I'm touching you on the right side, in your hand, or so on and so forth, okay?
Okay.
Alright,
My right arm.
okay?
My right knee. My left arm. My right side of my neck. My left thigh.
Alright, sounds good. Thank you so much. Next, I'm going to actually inspect your chest area. We would normally never have clothes on, but we're sadly gonna have clothes on for this video. I'm so sorry. Alright, so normally I'd probably ask her to take her shirt off, and in the clinical appointment, she probably wouldn't be wearing any undergarments, but we could still do it with an undergarment. And I would inspect your chest. I don't think that you have any lesions or redness, do you?
No.
Any pain?
No.
Alright. So then I would auscultate her heart sounds. So I'm just going to be auscultating your heart sounds. Have you had any heart problems?
No.
No? No history of hypertension?
Yes.
Or, yeah, okay. How long have you had hypertension for?
3 years.
3 years? Alright. I would have already known this from her vital signs, but that was also good for patient history. Alright. So I'm just going to auscultate your heart sounds. Let me know if you feel uncomfortable or anything like that throughout this, alright?
Okay.
So I'm going to start with the atrial valve, center intercostal space, and then I'm going to move over here to her pulmonic valve. And then I'm going to go down to the third notch. first point. And I'm going to go back over here. This is her tricuspid valve. And I'm going to go back over here to her midclavicular fifth intercostal space for her mitral valve or her apical pulse. And then I'm actually going to go ahead and check the radial pulse at the same time. We're going to see if there's a pulse deficit. We usually do this for 1 minute, but it might be a little shorter for the video. Alright. I usually listen to this for 1 full minute. We're not going to do it today. There was actually a less than 1 second, but a little bit of a lag between your apical pulse and your radial pulse, but that's fine. I know that you're also a little nervous, so it's okay. But everything else, I could hear her heart sounds. I didn't hear any abnormal heart sounds by any chance. I will go ahead and auscultate again with the bell of my stethoscope, and I just want to listen for any like wheezing or anything while I'm here. Alright. Just breathe in normally. If you could also turn to the side, I'm going to go ahead and listen to your back. Alright. I'm going to listen to your back. I just want you to breathe in for me. You're good. You can actually stay there. I'm going to just say yes. Alright. I didn't hear any wheezing or stridor or any muffled breath sounds during that, so I wouldn't suspect any off the bat problems in her lungs. If I did hear things such as wheezing, I would suspect something like pneumonia, where there's fluid in the lungs that could interrupt the sound of her breathing. I'm also going to check for whispered pectorally. So what I want you to do, or actually I'm going to test for tactile firmness. So what I want you to do is every time that I touch you, I want you to say the words 99, okay?
Okay.
Alright.
99. 99. 99. 99. 99. 99.
Alright. There was no abnormalities with that test. I also am going to check for whispered pectorally now. So I want you to whisper 99 every time I touch you with my stethoscope. Alright. Okay. So we're checking for here. Sometimes whenever there is fluid in the lungs or anything affecting the lungs, the whisper can actually sound higher when I'm doing the stethoscope, but that was not here today. You can turn back around now. Oh, actually, I'm so sorry. While I'm here, I'm going to go ahead and assess your spine. So I'm just going to assess your spine real quick. Do you have any history of spinal problems or back problems?
Nope.
Okay. Her spine seems to be midline. It seems to have a good curvature. She is sitting a little forward. That's just because of the bed. I'm also going to check your chest expansion while I'm here. So I'm just going to put my arms right here. I'm in my third 10th muscle space. What I want you to do is I want you to take a big breath in and then out. Alright. So it was equal expansion on both sides. Now you can turn around. so sorry for all the movement.
No, you're good.
Alright, I'm gonna check your chest expansion from the front as well. So I'm gonna get right here, I'm really sorry. And you do the same thing. Breathe in and out. Alright. Again, equal expansion on both sides. No deviation from one side to the other, which if that does happen, that could indicate something such as like a weak or collapsed lung, which would be really bad. Alright, are you still doing okay?
Yeah.
Alright, I'm gonna move on to inspecting your legs real quick, so I'm just gonna be touching you again.
Okay.
Alright. Any tenderness?
Nope.
Alright, lift your leg up, just gonna assess for some swelling. Alright. While I'm down here, I'm just gonna take this sock off real quick. And I'm gonna assess your feet. No swelling. I'm gonna do your cap refill. It's less than 2 seconds. Also, while I'm down here, I'm gonna go ahead and assess your pulse sites. So we're not gonna do the femoral pulse, but we normally do that in a clinical setting. I am gonna do your, can you put this down?
Sorry.
No, you're good. I'm gonna check your popliteal or popliteal pulse real quick behind your knee. Alright, and then I'm gonna check your pedal pulse. And your dorsus finalis. Alright, and we usually do this on both sides. Okay, I'm gonna give you your sock back. I'm really sorry. No, you can put it on if you want to.
It's good.
Okay. So there's no edema, no irregular redness. I don't see any lacerations of any kind, no swelling in the feet. Her pulses are 2+. I would also check the other side to make sure there's not a pulse deficit, but for the sake of time, I'm not going to do that today. There was nothing abnormal that I could find. Alright. I am going to wash my hands real quick because I did forget something, so I'm going to do my hand washing procedure. Alright. You can go ahead and put your sock on.
Oh, okay.
I feel bad. Okay, I'm gonna check your strength real quick. So I'm gonna check for resistance. So the first thing I want you to do is I want you to kind of move your arms like this, kind of like this, and I want you to pull. All right. And then I want you to push. Alright, so you're able to push with resistance. And then I'm going to get you to squeeze my fingers real quick. Okay, good. Strength was equal on both sides. I'm going to squeeze my fingers. I also want you to do the same thing with your feet, so I want you to lift up with your foot and push against my hand.
Wait, I'm confused.
Push up with your foot against my hand.
Oh, push up.
Yeah.
Okay.
Do it on the other side. Alright. And then I want you to push down on my hand. Same with the other foot. Alright, that's good. Did you experience any pain doing that? Alright. Her strength is strong. She's able to push away with resistance on both her arms and her feet. I also would like to do a Romberg test that I forgot earlier. So if I could actually have you stand up. I think you're going to be in the frame. Okay, so what I want you to do is I want you to cross your arms. And I want you to close your eyes. And I want you to stand there and try not to move. And she already has her feet out. I didn't have to tell her, but we would also tell them to do their feet shoulder width apart. For the sake of time, I'm gonna ask you to stop. She doesn't seem to be swaying or anything, which is good. You can sit down. We would usually do this for longer, but we are checking for any swaying. This could indicate some problems with balance when we're doing the Romberg test, which is a part of inspecting the ears and everything. Did you experience any dizziness during that?
No.
All right. Neither when you were stood up or when you were just standing there?
No.
All right. That's fine. Well, thank you so much for doing this head to toe for me. Yeah, that's the end of my head to toe. I say thank you so much, and before I would leave, I would make sure if they were in a bed that their bed is put to the lowest position, that their not all of their guardrails are up. If they need one up, that's fine, but not all 4. I would also make sure the call light is right next to them, and I would ask them if they needed to go to the bathroom while I was in here, if they needed anything of me at all.
No, I'm
Anything?
good.
All right. Thank you so much, Olivia. It was so nice to be your nurse today.
Bye.
Bye, Rezinka.